Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to talk to you guys about what to expect when your primary care doctor leaves the practice or when you move and you need to find another primary care doctor. So I want to first start by saying that medicine is an art. And so every time you go and meet a new doctor, you're going to find that they practice a little bit differently. And that's what makes medicine so interesting and such a fascinating profession. Every time I interact with someone, I'm going to probably handle it just a little bit differently. There are guidelines, of course, but every doctor is going to manage things just a little bit differently. So let's talk about controlled substances. And controlled substances include things like benzodiazepines, narcotics, and ADHD medications. Let's start with narcotics. Narcotics are things like Norco, hydrocodone, Percocet, and oxycodone. If you are someone that's receiving chronic pain medications, chronic narcotics from your primary care doctor, I want to just say that when that doctor leaves or when you transition to a new doctor, you should not expect that that new doctor is going to automatically decide to fill those narcotics for you. That doctor may decide to talk with you about weaning down or completely off of those narcotics, or they may decide to send you to a pain specialist. I know at my clinic, we do not prescribe chronic pain medications at all. So we refer anyone that's on chronic narcotics to a pain specialist. Okay, and next up is a class of medications called benzodiazepines. These are also controlled substances. And these are things like Valium, Xanax, clonazepam, Klonopin. And these medications have a real potential for dependence and abuse and addiction. So any doctor is going to be real hesitant to automatically prescribe these medications for you, especially if you're not on something like an SSRI like Prozac or Lexapro or Celexa. These medications just make a lot of doctors uncomfortable, including myself. So I usually try to strongly discourage patients from using these medications long term. And so if you have been getting chronic benzodiazepines from your primary care doctor, do not expect that your new primary care doctor is going to automatically give those to you. They may decide to send you to psychiatry for further evaluation or to prescribe those medications. And lastly, let's talk about the class of medications for ADHD. These include things like Concerta, Vyvanse, and Adderall. These medications are also controlled, and so different doctors have different comfort levels with prescribing these medications. I know for myself, I just didn't get a lot of training on starting, stopping, and changing ADHD medications in adults, so I really don't enjoy prescribing those. So I will send patients to psychiatry. So if you are getting ADHD medications from your current doctor, if and when you decide to go see a new doctor, do not expect that that new doctor will automatically give you those medications. They might, but just have a realistic expectation. So with all of these classes of medications, if and when you decide to leave your primary care doctor, or if and when that primary care doctor decides to leave the current practice that they're in, have a conversation with them about the transition to the new doctor, if at all possible. Be sure to send old records to the new doctor, and be sure to talk with the doctor that's leaving or before you leave what the plan's going to be. Can you get some extra medication? Do they know of a psychiatrist or a pain specialist in the new city that you're moving to? Or do they have a recommendation for a primary care doctor that's like-minded and can continue these medications for you? I really do miss the days when we had long-term relationships with patients. That was such a cool part of internal medicine in my practice. But as people start to move more and as doctors tend to change practices much more often, you're going to find that these long-term relationships just aren't going to be as common, which is unfortunate. I hope that helps, and thanks for joining me.